Welcome to Diagnosing Health Care, a podcast featuring thought-provoking conversations about the latest legal, policy, and regulatory issues in healthcare. While these issues may seem like hurdles, we'll also look at the business opportunities and solutions that exist. Diagnosing Healthcare is brought to you by the healthcare lawyers at Epstein, Becker, Green, a leading law firm that has more than 40 years' experience serving clients in the healthcare industry nationwide.
Hello, everyone, and welcome to Diagnosing Healthcare. I'm Paulina Grabczak, an attorney in Epstein, Becker, Green's healthcare and life sciences practice in our Newark, New Jersey office. I'll be your host for today's episode. Today, we have a very exciting and timely podcast. We are going to discuss what to expect in the first 100 days of the new administration, focusing on healthcare policy. Before we begin, as is customary for our more policy-focused podcasts, I would like to take a few moments to make an important clarification. We are going to be focusing on the policy implications of the Biden administration's first 100 days. We are certain that our conversation today will touch upon both the legislative and administrative process and therefore necessarily touch upon politics. But EBG does not endorse any particular political party. Also, we want to note that this podcast was recorded on Friday, January 15, 2021. We mention this as we find ourselves on the eve of a new administration, and with that, rapid changes and announcements. Let's get started. Here with me today are two of my colleagues. Ted Kennedy Jr., a partner here in our Stamford, Connecticut office, who has been a healthcare regulatory attorney for over 20 years. And Philo Hall, a senior counselor in EBG's Washington, D.C. office. Prior to joining the firm, Philo served in the Bush administration with roles in the Department of Health and Human Services and the White House Domestic Policy Council. Hello, Ted and Philo.
Hello, Paulina. Great to be here with you.
Hello.
All right, let's get started. So Philo, everyone has heard so much about the first 100 days. Tell us, what happens during the first 100 days of a new administration? Help us set the stage.
Thank you, Paulina. And it is interesting to set the stage. And I think the first thing that people need to understand is level setting expectations. People come into a new administration with so many exciting aspirations about an agenda and what will get done and the highest priorities. But the first thing I can tell you is that for the Biden administration itself, in the first 100 days, their highest priority will be staffing up. It will be personnel. I know it's maybe a little frustrating and hard to imagine, but there are 4,000 political appointee positions in the federal government that the Biden administration will have to fill. It takes time. Even though they may have been working on it for 4 to 6 months already, it still takes a lot of time to interview applicants, hire them for positions, make sure that they can work together, and 1,200 of those positions require Senate confirmation. Now, here's a quick gloss on a few other things that really dominate an administration in its first 100 days. There are some laws for which they have to write regulations within a year, and they have to start working on them now. For instance, a recently passed surprise billing law for which they need to draft regulations quickly, within 1 year. And there are other laws that have just been passed by Congress or that will be passed by Congress where they have to draft the regulations and they cannot set the agenda. Apart from that, they will be very busy reviewing all of, let's say, the last 2 years worth of regulations issued under the Trump administration to determine what can stay or what they may want to revise. It's an incredible amount of work just to assess what they want their policy agenda to be for the first year or so. I know many people might think that you come in with the agenda set based on the campaign, but I can tell you from personal experience that what a campaign promises and what an administration tries to implement as policy are two separate things. So all of the people in the Biden administration have to sit down sort of from square one and start getting into the nitty-gritty details of what they want their administration policy to be. And that in the short term is going to be driven by responding to the COVID pandemic.
Understood. Ted, what are your thoughts on the first 100 days?
I believe that President-elect Biden's first 100 days will largely be shaped on how the president-elect addresses the health and economic fallout of the coronavirus. We just learned about his proposal, America Rescue Plan, proposed on Thursday, the 14th of January, that calls for $1.9 trillion in new federal spending. I also want to make note that many of these dollars will also go to strengthening Obamacare, to coverage expansion, lowering out-of-pocket costs for over 10 million Americans. So within this coronavirus relief package, there is some healthcare. I'm not just talking about increased money for vaccinations and testing and so forth. It will also contain money to expand coverage and other healthcare initiatives. But I think the president-elect's need to address the pandemic will drive his policy moves in the first few months of office, and all of his stated goals will depend on his tackling of the pandemic response.
And that certainly makes sense given just the reality that we live in right now. So, Philo, what are your thoughts about the highest priorities for the Biden administration, aside from COVID-19 response?
Yes, Ted hinted at one of them in terms of shoring up Obamacare. So while a few moments ago I said that campaign promises do not fully establish what an administration's policy priorities will be, I think we can say that after COVID, the highest healthcare priorities for the Biden administration will be prescription drug prices and healthcare coverage. I think it is interesting to see how this emerging COVID relief package, COVID bailout package, may start some of the Biden administration's work on shoring up or securing health insurance coverage through the Affordable Care Act framework. That will be very interesting to track. There's been some discussion over whether or not, what kind of broad, more aggressive coverage expansion may have been pushed, as was debated during the campaign, such as Medicare for all or a public option plan, or lowering the age of Medicare to expand publicly sponsored coverage. At the very least, a good start on that for the Biden administration will be shoring up and facilitating access to exchange plans through the ACA framework. And the next big issue that I mentioned is the prescription drug price issues. Now, this will be very challenging. What the Trump administration certainly was very active on, but we may see ultimately frustrated on, is trying to significantly lower, meaningfully lower prescription drug prices through regulation alone without congressional support, without new lawmaking. And we might touch upon the host of regulations that the Trump administration has put forward or attempted to put forward to reduce those prescription drug prices. We'll go into the details of those. But I think what the Trump administration found, facing a House of Representatives that was Democratic controlled, that it is very, very difficult to really do any regulatory policy without Congress acting. So I expect at some point we will see the Biden administration trying to coordinate with the new democratically controlled Congress on prescription drug pricing legislation. I think we will see that. It will be very interesting to see if the Biden administration even attempts any sort of reduction in prescription drug prices through regulation alone, an attempt that frustrated both the Trump administration and the Obama administration.
Ted, what is your take on how easy it will be for the Biden administration to work with Congress?
Of course, we were watching closely the outcome of the Senate elections in Georgia. We have to remember that even though there's a 50-50 split with, of course, the vice president breaking a tie, it's still a very tight margin in the House and in the Senate. And I think it's going to mean that many of the more ambitious policy goals will need to be put on hold, at least for the time being. Touching on what Philo said about lowering the cost of prescription drugs. So we just learned, of course, where both Democrats and Republicans have been supportive of various proposals to lower the cost of high drug prices that Americans pay. And we just saw, for example, on January 1st, more than 100 pharmaceutical companies raised prices on over 600 drugs. So this is what's driving the debate, that Americans are paying a lot for their pharmaceuticals, much more than residents of Canada or in Europe. So what I think is interesting is tracking and analyzing these various bills, these various proposals to lower drug prices that have been introduced by both Democrats and Republicans. So they range in 20 or 30 different types of proposals, from TV advertising to direct Medicare negotiation to patent reform to many, many other different types of ways to get at the high cost of prescription drugs. And there's been over 185 bills that have been filed. But if you look at who supports some of these bills, Democrats and Republicans, you'll find that there's a surprising agreement in a number of different drug pricing proposals, such as imposing price caps, speeding up access to generics, tax penalties for price increases, PBM reforms, even international price indexing and benchmarking. So I think that there is, if you look at these and analyze these various proposals and see who supports them, you'll find that there is a broad political consensus on a number of specific ways to tackle the high cost of prescription drugs. Just getting back to another point that Philo made about, and what we're focusing on at Epstein, Becker, Green, are what mechanisms exist from an administrative law position to affect healthcare policy that can bypass Congress, that for which you can just establish either through executive order or through regulation or sub-regulatory guidance. We're going to see a very active administrative law, healthcare regulatory changes taking place as the new Biden administration halts, analyzes, undoes, or maybe continues some of the proposals from the so-called midnight rules that have been laid down by the Trump administration on their way out the door. So I think that's going to be very interesting to see. Every president looks at the recent regulations that were done at the last minute, at the final hour of the previous administration, especially if party entering the White House is different than the one entering. And so I think that there are many of these, and I know that we'll plan on discussing some of the hot topics in the midnight rules and regulations in the rest of this podcast.
And that's a fantastic segue for us. Thank you so much, Ted. So, Philo, what are your thoughts on some of these midnight rules? Which ones should our listeners be taking a look at?
First, let me provide a little bit of context. I mean, what is a midnight rule? What rule is a midnight rule versus not a midnight rule? You know, the expression midnight rule is just really slang. There's no precise definition. It tends to refer to regulations that are not regularly scheduled, that are issued in, let's say, even the final 6 months of an administration, even before an administration knows whether or not it's ongoing, but especially if once an administration has, say, lost an election or it's a lame duck administration, the pace of issuing of the rules increases. And so that's sort of the first category. And the second category the second qualification in looking at these rules is that you find that these rules were held back for a lame duck period because they appear to be either very controversial in their subject matter, controversial in their policy direction, or another category we'll say is just maybe not fully baked, which might be the case with some of these prescription drug rules where it's a topic everyone cares about, it's a policy direction where there may be some agreement, but this was rushed out at the last moment without being as thoroughly vetted, completed, without responding to all healthcare industry stakeholder comments the way you normally would see with complex health policy regulation. So it really is sometimes ideas which are, legitimate on their face, but maybe not fully baked. I'll flag a couple. First is the what we're calling the rebate rule, which is a final rule released by the Trump administration in December where they're amending the safe harbor regulations of the anti-kickback statute to no longer permit rebates from pharmaceutical manufacturers to Medicare health plans and PBMs unless 100% of the value of the rebate is passed through at the point of sale to the consumer. Now, such rebates undergird a great part of the Medicare coverage system. So this is a rather radical proposal, so radical that the Trump administration actually withdrew this rule earlier in the administration after proposing it. They decided to withdraw it, and it came back to life and it was finalized in December. So this is a very controversial rule with a lot of opposition from the health plan industry, the PBM industry, and a lot of questions over how it actually works. So this will be one of the first things where the industry is looking to the Biden administration to see if it will revise it. I'll just mention another very quickly, and that is the most favored nation rule, under which Medicare reimbursement for Part B drugs, this is not over-the-counter prescription drugs, these are drugs that are administered in a physician's office, infusion drugs, cancer therapies, injections for osteoarthritis. These are reimbursed under Medicare Part B. These tend to be some of the costliest drugs in the Medicare program. And the Trump administration finalized a rule as a part of a demonstration program under the Medicare Innovation Center, under which reimbursement for these drugs will be based on international prices. Now, again, I think as Ted mentioned, this is an example of one of those ideas which actually does have a lot of support on the Democratic side, basing reimbursement or having it somehow tied to international prices. But this rule was done in a very expedited fashion, and it's not clear if it was entirely consistent with the Administrative Procedures Act. So this rule has received a preliminary injunction in federal court just earlier this week, blocking its immediate implementation because it was essentially rushed out without industry feedback. Now, the next question, which makes this very complicated, is that the court is now reviewing whether or not CMS had the authority to do this type of policy in a demonstration. Now, that's something where the Biden administration may actually try to defend the rule, because I don't think they want to lose or limit their authority to do interesting reimbursement demonstrations under the Medicare Innovation Center. So those are just two, I think, of the sort of highest profile, very interesting rules where it may not be completely clear what the Biden administration is going to do. Their position on these rules is not going to be a binary choice, but will be actually rather complicated.
And Ted, what are your thoughts on these midnight rules?
Well, I think Philo gave a very good description of some of the more important midnight rules or last minute regulatory enactments. And I agree with Philo. Pegging drug prices to an international index, ending Medicare drug rebates to PBMs or undertaking PBM reforms. These are maybe seen like radical proposals, but in fact, as Philo pointed out, some of the elements of these rules may actually be supported by the incoming Biden administration. So it's very tricky to just say that every single rule that is enacted at the last minute is a bad rule, although some of them, maybe from the Biden administration, they may have some serious concerns about. Namely, another provision is what's called the sunset rule. And this is a rule requiring the regular review of healthcare regulations. Sounds like an innocuous sounding rule, but it automatically would expire any regulation after 10 years if it hasn't been reviewed, whether it's food safety, pharmaceutical, consumer protections, et cetera. So this has caused a lot of anxiety within the healthcare field because it automatically sunsets every single healthcare rule issued by HHS. So those are other types of rules that we are following and tracking. I think it's important, as we mentioned before, that every new president issues new executive orders, or President Trump, when he first got into office, issued 24 executive orders in his first 100 days to roll back some of the Obama healthcare regulations. And we're going to see the same thing done. It is, as Philo mentioned, it happens to one degree or another in nearly every single administration that comes in. Again, especially if different political parties are entering the White House.
Paulina, I should add on to what Ted was saying, sort of one example or another tool in which we will see the Biden administration start to evaluate those Trump midnight rules, which stay, which go. They're partially limited based on the timing of when those rules came out in the Trump administration. So this podcast we're recording it on the 15th. This is probably coming out right around inauguration. We'll probably see some executive orders right away on the afternoon of the 20th. One thing folks should also look for is a memorandum from the White House Chief of Staff to agency heads regarding midnight regulations. This is something that every administration has done going back at least to the Clinton administration. It's a very similar White House Chief of Staff memorandum, and it will direct agency heads to say if you have a regulation that you have submitted to the Office of Management and Budget for review, take it back for at least 90 days to give us some time. If you have a regulation that you have finalized, but it is not yet effective, withdraw it and for at least 90 days. It might be 60 days, it might be 90 days. We have to wait to see the memo, what it says. The point is that there's a time frame wherein very last minute midnight regulations that the Trump administration put out will be withdrawn for review if they're not finalized and effective. But that means that some regulations that have gone into effect, maybe they were released earlier in the fall, if they are effective, they cannot be withdrawn. And instead, what the Biden administration will have to do is start new notice and comment rulemaking to revise a policy. It might be, we have this policy that the Trump administration is going to put into effect in 2022, and we might want to move it back 1 year to 2023 and accept more comments on it. And so we ask the industry for comments on that proposal. So again, it's something that will play out over months in 2021, but some of these midnight rules we might see drawn back to the agencies within the first few weeks of the Biden administration.
And that's a fantastic point. We certainly expect to see signaling within the first 100 days. Ted, what is your response? What sort of signaling do you expect to see in the first 100?
Well, I think it's clear that President-elect Biden was elected because although he's a Democrat, he has a long history of working in a bipartisan consensus building fashion, which is, I think, what the electorate was really calling for when they elected him. So I'm really imagining that most of the things that, from a healthcare perspective, that we're going to see early on is focusing on items such as drug pricing that we talked about a moment ago that enjoy broad bipartisan support and that are very achievable. I'm talking about strengthening mental health services, for example, and enforcing and fortifying and modernizing mental health parity rules and laws. I also imagine the area of telehealth being strengthened. During the pandemic, there were a number of emergency regulatory relief that was issued to a number of different sectors during the public health emergency. And this allowed a relaxation of the way telehealth, for example, is performed, relaxing scope of practice rules in post-acute settings, things like that, which I think a number of these groups, these affected sectors, are going to want to continue even after the pandemic is over. But I think that it's safe to say that the declaration of the public health emergency will probably continue for much longer under a Biden-Harris administration than probably would have happened under a Trump-Pence administration. And we're also looking and tracking the changes that were made, the regulatory, sub-regulatory guidance that came out of HHS and other agencies regarding healthcare services, which ones of those regulatory relief proposals will remain even after COVID is over.
Understood. And Ted, did you want to talk a little bit about some non-legislative tools that the Biden administration has?
Yes, I think as both Philo and I have been discussing, most of the time, we focus on these grand legislative initiatives, but for those who track and and analyze healthcare policy, we know that so much regulatory and healthcare policy can be made at the administrative law level. I'm talking about, executive orders, agency guidance, regulations that can be done. It won't be easy because, as Philo said at the beginning of this podcast, the administration is going to be, just staffing up these many departments. So we see there's a number of ways in which to affect healthcare policy short of actual legislative proposal. Of course, one of the ways is through the reconciliation process. The reconciliation process only requires a simple majority, 51 votes in the Senate. Other larger, which I imagine when I learned of how the strengthening of Obamacare and coverage expansion would be included in President-elect Biden's recent $1.9 trillion proposal. It's not just going to go to vaccine rollout, testing, lengthening of unemployment benefits, and that sort of thing. He's also using his coverage expansion goal to tuck it in there, whereas it might not have been able to pass his goal of coverage expansion in a standalone piece of legislation. And this can probably and Philo can maybe touch on the reconciliation process and which types of healthcare policy proposals can be passed with a simple majority or which one need to abide by the 60-vote cloture rule.
Sure, just very briefly, and this will be very interesting to see. Just normally, a measure would require a simple majority to pass in the Senate. And we're talking about the Senate because the House can really just about pass whatever it wants to, whatever the majority party wants to. And I'm a former Senate staffer, so I just have this reductive view of the House. That's my preference. In the Senate, you normally need a 51 vote majority to pass any issue, unless someone is filibustering, what we call filibuster, but really amounts to objecting to invoking cloture. Do you object to ending debate on a bill and moving to final passage? And that objection requires a 60 vote threshold to pass. And that is referred to as a cloture vote. That is what has become the shorthand that we refer to as a filibuster, requiring 60 votes to overcome it. That has been a barrier that many parties and administrations have not been able to overcome when pushing significant legislation. So the fallback is this sort of little known provision called reconciliation, where there are budget rules in the Senate and how it handles a limited number of issues. Reconciliation can only be used once a year in the Senate, and it can only be used for specific law that is adjusting tax revenue, entitlement spending, or the debt limit. You can have one issue addressing each of those three topics every year under each budget. This is something that the Senate has to prepare for, months in advance to prepare a vote on this. If you're pushing an issue that fits within that category, then you have an expedited review and you can pass an issue with only 51 votes as opposed to 60. This is the tool that Congress used in 2017 to set the individual mandate penalty at $0. That was all they could do because they were limited to just doing something that affected government revenue. The reconciliation has been used 25 times since 1980. So it's not completely obscure, but not common. And as Ted said, I think there's a lot of opportunity for some, bipartisan addressing healthcare issues and COVID relief upon which there is wide agreement. But because the Senate is a 50-50 split, I imagine that leadership at some point will have to fall back on using budget reconciliation process to get some priorities through, if they can frame those priorities as related to tax revenue, entitlement spending, or debt limits.
All right. Well, our time together is coming to a close. So, Ted, loaded question. What are your final thoughts for today?
Well, reflect on the fact that it's a very exciting time for healthcare in the United States. We're seeing so much new innovation in the pharmaceutical space, in the payer space, in new ways to provide care, value-based purchasing, physician alignment with payers. There's so much change that is happening in the healthcare sector, and it's really exciting to see. And I think it's going to be very interesting to watch which ones of these priorities the Biden administration is going to forward. But I think many of the healthcare policy proposals that lower cost and increase quality actually enjoy broad bipartisan support.
All right, Philo, same loaded question. What are your final thoughts?
Well, I agree with exactly what Ted said on the excitement of watching what are really kind of complicated questions for the Biden administration of what to keep and what to revise and what to drop from the Trump administration rulemaking. I'll just add one other quick category: price transparency, such as requiring hospitals to publicly disclose their privately negotiated rates with all payers. I'm sure everyone's in favor of transparency in prices, but that's a very novel proposal. Will the Biden administration keep that policy? My other final thought is, again, just based on personal experience in an administration and thinking about the hardworking staffers in the administration who are really going to be putting in 80-hour weeks and dedicating their whole lifestyle to this new administration, to be patient, because they're going to be working very hard, and they've got a great department with great staff and career officials that they're working with. But it just takes a lot of time when you are the last person who has to make the policy decisions before releasing it to the public. So they've got a lot to do, and we should just be grateful that we don't have as much to do as they do. And instead, we just get to watch it, which is the fun part.
Yes, it sure is, and certainly talking about them as well. Ted, Philo, thank you both so much for taking the time to speak with me today. We spoke about many healthcare policies, but some of the most noteworthy initiatives likely will be the Biden administration's COVID-19 response, which will be important to watch as the laws, regulations, and policies surrounding healthcare continue to evolve and we continue talking about them. This is the first time a new administration is starting with both an impeachment proceeding and global pandemic, and these two realities are likely to impact priorities. Something I think all of our listeners appreciate, and that is healthcare policy is very difficult. Reform is very complex, and it can be slow. That's all for today's episode. On behalf of Epstein, Becker, and Green, thank you for tuning in. I'm Paulina Grabczak, and this has been Diagnosing Health Care. We look forward to having you join us again.
Thank you for listening to Diagnosing Health Care. For show notes on today's episode, additional episodes, and more insights on trending issues in healthcare, please visit diagnosinghealthcare.com and be sure to subscribe on your preferred platform. The Employment Law This Week and Diagnosing Healthcare podcasts are presented by Epstein, Becker, and Green, PC. All rights are reserved. This audio recording includes information about legal issues and legal developments. Such materials are for informational purposes only and may not reflect the most current legal developments. These informational materials are not intended and should not be taken as legal advice on any particular set of facts or circumstances, and these materials are not a substitute for the advice of competent counsel. The content reflects the personal views and opinions of the participants. No attorney-client relationship has been created by this audio recording. This audio recording may be considered attorney advertising in some jurisdictions under the applicable law and ethical rules. The determination of the need for legal services and the choice of a lawyer are extremely important decisions and should not be based solely upon advertisements or self-proclaimed expertise. No representation is made that the quality of the legal services to be performed is greater than the quality of legal services performed by other lawyers.